It will be some little change. Instead of the satellite symposium, we'll start the abstract presentation. We'll start by the first speaker, Dr. Sultana Abd Al Aziz. She will talk about diffuse alveolar hemorrhage in lupus nephritis patients.
Assalamu alaikum. I would like to thank the scientific and the organizing committee for accepting my abstract as an oral presentation. My presentation will be about diffuse alveolar hemorrhage in lupus nephritis patients. It's a multi-center retrospective study. Diffuse alveolar hemorrhage is a rare and potentially lethal complication of systemic lupus erythematosus with a high mortality rate. It occurs more frequently in patients with lupus nephritis. The aim of the study was to explore the characteristics of patients who developed diffuse alveolar hemorrhage with lupus nephritis, risk factors that predispose to alveolar hemorrhage, treatment response, and outcomes. It's a multi-center retrospective cohort study involving 6 centers in Saudi Arabia. Systemic lupus erythematosus patients meeting the SLIC criteria with lupus nephritis, either biopsy proven or with proteinuria or renal impairment due to lupus that were unable to do a kidney biopsy, that were presented to the ICU, and having diffuse alveolar hemorrhage were included in the study. The age was above 13 years of age. Diffuse alveolar hemorrhage was defined as symptoms in the sense of dyspnea, cough, hemoptysis of alveolar hemorrhage, or signs on bronchoscopy with bloody return, or hemosiderin-laden macrophages. A new drop in hemoglobin, with typically about 1.5 to 2 grams per deciliter, new infiltrates on chest imaging. An identical number of control group with lupus nephritis was also studied. Data was obtained from medical records using a data sheet, demographics, date of the diagnosis of lupus, date of presentation of the alveolar hemorrhage, clinical presentation, detection of the alveolar hemorrhage proven by radiology, alveolar and biopsy, as well as laboratory parameters and outcomes were documented. An identical number of control group with lupus nephritis was also studied. Data was obtained from medical records using a data sheet. Statistical analysis was used by using the SPSS version 23, descriptive analysis with categorical variables as presented at percentages, and chi-square was done for comparison. Continuous variables present by mean and standard deviation. Comparing the two means was used by the independent t-test. Survival analysis was done using the Kaplan-Meier curves, and survival was compared by the log-rank test. Institutional ethical approval was obtained. The age, we can see that in between both the lupus nephritis as well as the diffuse alveolar hemorrhage, they were comparable. And the mean age was 31, and in the lupus nephritis group was 33. Age at diagnosis of systemic lupus erythematosus was 23, and in the lupus nephritis group was 22. Age at the diffuse alveolar hemorrhage was 28. And the females were more, as we know, as in SLE, 87, and it was in the lupus nephritis group, 87. All of them showed a lupus, proliferative type of lupus nephritis, mainly class 2, class 4, and 5, or a combination. And in the lupus nephritis, we had about 6 cases that had class 3. They had a mean protein that was comparable, as well as the complement, and the selena-slidi was comparable also. We can see the characteristic of patients with the diffuse alveolar hemorrhage. The hemoglobin drop was 7.76, the mean, and the drop was about 2.72. The ICU stay that the patient had was 15 days, And oxygen saturation, it was 85%. The presentation of SLE, the diagnosis of diffuse alveolar hemorrhage from the onset of lupus, we had about 53% that was occurred before the first 5 years of diagnosis. The common clinical presentation as well as diagnostic features, we had shortness of the breath was the most common, followed by the cough, 83%, hemoptysis, and fever was seen in about 6 patients. And the pneumonia was present as initially diagnosed as pneumonia in about 46%. Chest X-ray was the main the modality used in the diagnosis, followed by CT scan. We had 35% that had been diagnosed on bronchoscopy as well as on hemosiderin-laden crystals. Management of patients with diffuse alveolar hemorrhage, that is the main, universally, all of them were treated with methylprednisolone, and 91% were used plasmapheresis. Cyclophosphamide was given in 60%, and we had a few that were on mycophenolate. IVIG was given in patients that had mainly on infections or other causes were immunosuppressive, that was not given in 35%. In one patient, rituximab was given. And mechanical ventilation was given in 65%. Outcome of patients with diffuse alveolar hemorrhage, we had resolution occurred in more than 60%, and death was seen in about 35%. This we can see that this is the lowest among all the reported other series of the same kind. In lupus nephritis patient, Lee has been reported that even though the sample was very small, 57% was the mortality rate, and patient in a group in 9 of the 12 patients with diffuse alveolar hemorrhage, it was 75% mortality, and Mahmoud et al., they had in SLE patients, they showed that 66%. Our cohort is one of the largest cohort that has been reported with diffuse alveolar hemorrhage. Infection was the main cause. We had 57%, and as well as the common organisms that were seen with Klebsiella, Pseudomonas, and Acinetobacter. In comparison with the diffuse alveolar hemorrhage with the lupus nephritis, the cause we had seen that CNS, especially organic vein syndrome, visual disturbance, as well as vasculitis and elevated fever, had been a statistical significance in the occurrence of diffuse alveolar hemorrhage. In comparison with immunological profile, it was seen that there was no difference of statistical significance in both the diffuse alveolar hemorrhage as well as the lupus nephritis group. In the survival curves, we had a mean survival that is in the diffuse alveolar hemorrhage, it was about 13 years, and in the lupus nephritis group was 21%. In a survival rate, curve in the Kaplan-Meier, we had that when SLE was set at 0 point and over a 25 years old follow-up, it showed there was a reduction in the survival in the patients with diffuse alveolar hemorrhage. In conclusion, in a multi-center cohort series with diffuse alveolar hemorrhage, patients with CNS involvement, vasculitis, fever were associated with occurrence of diffuse alveolar hemorrhage. Mortality in our cohort was low in comparison with the previous series, which can be explained by the early use of early diagnosis and aggressive management. With this, I come to my end. Thank you.
Thank you. Doctor, we can have few questions if there's any. Any questions? Yes, please.
Musa Al-Abbas, consultant dermatologist. My question is, was everybody underwent bronchoscopy to confirm diffuse alveolar hemorrhage?
No.
Okay, because that might be a confounding, that has affected your result as well.
Well, we made it, we haven't made a point, the number of the patients that we included only those that are either bronchoscopy or chest X-ray or on CT scan, the diagnosis. It wasn't not only the bronchoscopy. We had 3 criteria for the diagnosis to be included.
Because I mean, in general, DAH has to be confirmed by bronchoscopy, right, with sequential aliquot to prove it rather than.
Well, we are saying this in a retrospective. This is a retrospective study. So I'm presenting. It's not a prospective study. So the cases that we had a criteria, drop in hemoglobin, desaturation, as well as new chest X-rays were the conclusion criteria.
Thank you very much.
Okay.
Okay, thank you.